Okay, this is the second part of the perfusion lecture about peripheral vascular disease. This is dealing with arterial and venous side of things, so we're going to jump right in on that. This is a picture of the heart and a way to kind of map the flow of blood throughout the body, just to kind of keep that in mind of as you're dealing with these diseases, okay? And understanding how blood is flowing. And you also want to understand how the blood is returned to the heart as well. So this venous return, this will help in understanding specifically these peripheral vascular diseases on the venous side of things. Your muscles play a part in this, and then you'll see that even in those veins that there are little vessels and stuff that kind of help prevent, our valves rather, that kind of help prevent blood from back flowing. So anytime there's a compromise in the system on either side, you can see issues with perfusion and blood flow. All right, that clotting cascade. This is the video that I showed in class. I put a description on the and a link to the description below that you can look that up. It's also on YouTube. Thromboembolism. This is how what we're getting into. So a patient that presents with decreased mobility or decreased circulation, they're standing a chance at increasing their risk for developing this. So patients with cardiac diseases, patients coming from surgeries, or certain procedures that we may do in the hospital, any type of patient that's bedridden, they're at risk for this, for development of this. And so one of the major signs and symptoms or complications to this that we want to look for is pulmonary embolism. And that's just basically that clot that has developed in your leg has traveled to your lungs. And so a thorough assessment on the nurse behalf is important, and just continually monitoring and assessing a patient for this is also important. So that way we can pick up on changes. Our main goal is to prevent. We want to prevent issues like this, whether it be a clot in your legs. We want to prevent, if you have a clot in your legs, we want to prevent it traveling anywhere in your body. So prevention, prevention, prevention. But if you do develop something like a clot in your legs, we want to treat it. And usually anticoagulant therapy is what we'll use for that. Now, this is just a slide that kind of shows how plaque builds up in the arteries and the vessels, and you can kind of see how that creates a thrombus in the vessels itself, and how it kind of impairs blood flow. All right, this chart is taken directly from your book. It is in relation to the characteristics of arterial and venous insufficiency. And now Ms. Hill will hit on the ulcers part of things. One of the things I want to point out is the intermittent claudication that's related to arterial insufficiency. And so what you'll see is that as the patient or whoever has it is walking, you'll notice that they'll start having pain as they walk. And one of the reasons for that is that as you're moving and exerting energy, your body is requiring more oxygen. And so the demand goes up, but you're not able to meet that. And so you're not able to increase the supply of the O2 to that area. And so as a result, it starts hurting, and the pain is usually sharp and unrelenting. As far as pulses, one of the things in regards to that, understanding that with an arterial, if there's an issue with that, the pulse is either diminished or it's decreased. You can verify with a Doppler. So if you're unable to palpate it, use a Doppler to kind of verify, because sometimes you can hear it. On the venous side of things, you may have trouble palpating the pulse, but it's not because of the fact that of the insufficiency. It's just because of the fact that sometimes in the venous, on the venous side of things, patients pool blood in their lower extremities. And so that edema and that swelling can make it really hard to palpate something. And likewise, you can always verify pulses and stuff with the Doppler, okay? So don't just start charting absent pulses on everybody until it has been verified that you cannot even hear it with the Doppler. All right, some risk factors. You'll see similar risk factors throughout this whole entire presentation, just because it all intertwines with one another. Age is what you'll see consistently across everything. As one ages, your body changes, and so that's the same thing with your vessels. They become a little bit more stiff, and it could cause a little bit more peripheral resistance. It can impair your blood flow as well, and then all of that in turns kind of lead to your heart working a little harder, and so you could have some hypertrophy from that. It's particularly in that left ventricular side, just because that's the part that's pumping blood out to the body as a whole. And likewise, hypertension, diabetes, obesity, stress, sedentary lifestyle, all that is related. We saw those, listed with hypertension, and likewise, we see these as risk factors for peripheral vascular diseases. All right, peripheral artery disease, PAD, that's what this is for. There's a difference in our prevention and treatment options for this in relation to DVT, deep vein thrombosis. Okay, so in the peripheral arterial disease, what we want to do is be mindful about what we're doing with the patient. So our position strategies in this one is unique. That's what we want to pull out, unique things of how we're treating this patient. And so position strategies, we want to let the feet dangle. That way gravity can kind of work with us, using it to our advantage. And so it kind of helps pull blood towards the lower extremities. If you're having issues with lifestyle like smoking, you want to stop that because it's causing damage to your vessels. Stress, same thing. You want to kind of fix those underlying causes that can that is causing impaired blood flow to that lower extremity. And then just be mindful of temperatures, just because of the fact that keeping in mind if something is really, really cold, it's going to make things tighter. It's going to make the vessels smaller. And so you want to be mindful of extreme temperatures. Venous thrombosis. This can come from endothelial damage, venous stasis, or autocoagulation. And so if you're having damage to the vessels, that could be from trauma or surgery. If we're doing dialysis catheters, we're causing some type of damage to that vessel just because of the way we're entering. We're causing an entry to that vessel point. So keeping that in mind, that can kind of increase their risk for thrombosis. Any bedridden patient, anybody that's immobilized for whatever reason, your blood is kind of hanging out and just sitting still. So venous stasis puts you at risk. And then anytime somebody has altered coagulation, whether it's pregnancy, cancer, any type of clotting factor disorders, septicemia, any type of that, you will be at risk for developing this. And likewise, we'll see some similar risk factors as well. In addition for this, with varicose veins, surgeries, injuries, older adults, like I said, as you're aging, the aging process your body goes through certain changes. And so oral contraceptives, this is something that's particular to this, and that you'll see with women taking that. So you will want to be monitoring this with any woman that is taking oral contraceptives. So some of the things that we'll see in this is, as we'll see manifested, is edema and swelling. When we're assessing your extremities bilaterally, we may note that one is warmer than the other. Tenderness, what you want to look for is that pulmonary embolism, signs and symptoms of that. So if a patient starts developing shortness of breath all of a sudden, you'll want to do more of a focused assessment to try to understand where is this coming from. Is this something that we need to take other measures for? Do I need to call a doctor? Is it an oxygen issue? Like, why all of a sudden you are having problems breathing? Chest pain, things like that. So just understanding that I need to understand that this manifestation of a venous thrombosis could manifest. I could have issues with shortness of breath before I even realized that I had a clot in my leg. And sometimes, in often cases, you'll see that they'll have these other symptoms of like pulmonary embolism before they have determined that there was a clot present in the leg. So you just want to be mindful and do a thorough assessment of your patient, because that is what we give the doctor as information in order to provide care for our patient, to make treatment options, to make treatment decisions for our patients. So assessment is key. And so our goal is to prevent this. If we know that people are predisposed to this based on surgeries or based on, bed rest status, based on just age, things like that, the risk factors that we saw, if we know they're predisposed to this, we can take some measures to try to prevent that. And one of those things that you'll see in the hospital are TED holes or SCDs, because we want to start non-invasive and then move towards an invasive interventions. And so if they need more coverage, then what they can do is Lovenox, or they can do, the doctor may prescribe heparin in some patients, especially patients with kidney issues. They'll do a heparin. And so they may get medications just to kind of help prevent this. And If they're not able to move, we want to make sure that we're providing limb exercise, that we're providing range of motion for these patients in their lower extremities. If they're coming from surgery, we want to make sure that they're walking as early as they can, just to kind of help keep that blood circulating and to help prevent this. And then if you're sitting or standing for long periods of time, whether you're traveling, whether you're a truck driver, or just sometimes even in healthcare, you want to make sure that you're moving and that you get your legs working to kind of help push that blood back to the heart, and that blood doesn't kind of sit and increases the chances for a clot. So management of a person who does develop deep vein thrombosis, we want them to be bed rest. Whereas we wanted you moving before, now we want you still. Because remember, one of the complications that we're trying to prevent is that we don't want that clot to travel. And if it travels and get in your lungs, then we have a whole nother slew of problems that we're going to have to deal with. And so we want to keep that clot there until we can adequately treat it. And so we don't want you moving. We don't want to manipulate your legs and extremities. So we won't put SEDs on. We won't do things to kind of push that blood back to the heart like we were in the prevention with the TED hose and things like that, just because of the fact that we do not want to manipulate that extremity as much. We want to prevent, limit our manipulation of that. Anticoagulation therapy is what you'll see prescribed, and we'll get into medications here towards the end of the presentation. This is just some places that you can palpate for pulses as you're doing your assessment. And then just some nursing diagnosis. Can we expect, or what can we anticipate, or as we're assessing our patient? Do they have altered tissue perfusion? Chronic pain? They could be at risk for skin integrity, and then knowledge deficit. Just making sure we're educating our patient. That's key, because they need to understand that, especially if they have a clot, that they need to be knowledgeable of, hey, I don't need you getting up out of bed when I'm not in here. That you're bedridden, you're on bed rest for this reason, because we're trying to prevent a clot from moving from your legs to traveling up your body. Okay, so education to the patient is key. Medications. This is some of the medications that we will see, like we saw earlier in the presentation about how plaque can build up in the vessels. And so what we want to do is limit that. So we'll give a statin therapy for that. Tretinool is something that you'll see as well. And Miss Hill will get into that a little bit when she starts talking about her agents. Pleadol, intermittent claudication. This medicine I kind of want to hit on because of the fact that that is a medication that you will see given for patients with intermittent claudication. But you want to be mindful, because there are some contraindications, and making sure that the patient meet proper guidelines for, because there's certain cardiac conditions that makes this medication contraindicated. So we need to get a thorough history of this patient, their cardiac history. We need to understand the nature of their pain too, to make sure that it's actually true intermittent claudication. But aspirin and Plavix, you'll see those commonly given in the hospital as well, and so we can put you on that. Anticoagulation, so heparin and Lovenox. We hit on that earlier. Sometimes that's used as preventative measures. And then sometimes if we need to use it while you're bed rest with the clot and things like that, we can use it for that. You'll see patients, they can go home on Coumadin, Eliquis, or Xarelto. And just understanding that vitamin K is an antidote for that. So this is why we do that diet education for patients with the dark green leafy vegetables and things like that, to make sure that they're not overindulging in those vegetables that has this vitamin K, which is the reversal agent to the medication. So education, like we talked about knowledge definition, just educating your patient on that. And one other thing I want to mention before ending this slide is just remembering, if I'm giving all of this medicine that can kind of affect your blood, understanding what is my major risk factor. I'm trying to prevent you from clotting, but at the same time, I don't want to cause you to bleed out. So I'm increasing your risk for bleeding. So I need to be monitoring for signs and symptoms of bleeding. Okay. So just keep it in mind. And then just kind of like a little slide, just to kind of remind you of your role and your importance as a nurse, is that, all of this information that you're getting in nursing school it's not only just to pass a test, or it's not only to just to make a good grade in a particular course, but it's also preparing for, when you're out in the real world and you're you're standing in between, your patient and some type of life altering decision that can happen to that person. And so there's many situations that you will see yourself in as a nurse, and that as you're precepting and listening to other nurses, that you'll see that based on the nurse decision, whether they decided to do an intervention or withhold an intervention, ultimately end up saving a person's life based on their final assessment of a person before implementing that, whether it's drug therapy, whether it's a certain treatment decision that the doctor is making. So like I said, your role, you're the last person that the patient encounters. You're the last step before anything, if anything's going to go wrong, you're the last step before all that is happening. And so it could definitely save someone's life. That's why it's key to be alert, key to be understanding how you're assessing your patient. Is key to just have that awareness of what's going on and what's been ordered and why. Okay. And then, like I said, this all came from your book, so you guys can look up anything if you need further clarifications. All right. Well, this is the end of our PowerPoint presentation, so I hope you enjoy this, and best wishes on the test.